I was curious about the actual environmental benefits in using oral paracetamol in the operating theatre. It was also a challenge to rethink how we approach patient care more sustainably. I'm Jo-Anne, an anaesthetist at Changi General Hospital. I worked on a project about the use of oral paracetamol in place of intravenous paracetamol for elective surgeries. This is part of our concerted efforts to drive sustainability in healthcare at Changi General Hospital. While intravenous paracetamol is more commonly used in the operating theatre, research showed no clear benefit over oral paracetamol in many cases. At the same time, there are environmental concerns over the increasing use of intravenous paracetamol, which has a significant carbon footprint. We introduced a new method at Changi General Hospital to tackle this by implementing an oral paracetamol pre-medication program. This ensured that patients received effective pain management, but with less impact on the environment.
So the rollout of the intervention involved a change in our normal processes. We trained the doctors and nurses in the pre-assessment clinic, day surgery, and operating theatre on different aspects of the new pathway. We sent regular reminders on the changes and continually audited our progress and made subtle refinements along the way to ensure the success of the program.
With the new workflow, we work closely with the anaesthetists in ensuring our patients receive oral medications before their procedure. We have also observed that administering oral paracetamol is convenient and just as effective for patients in managing their pain. We are also proud to play a role in protecting our environment.
Since implementation, we've seen a 50% reduction in intravenous paracetamol use, saving about 3,000 bottles a year. Our carbon emissions have dropped significantly, contributing to a safe and more sustainable patient care. I hope this project will inspire others to adopt similar practices. Oral pre-medication is easily replicable across hospitals, and we're looking to expand this to include anti-inflammatories for select patients.